Well, I think one of the biggest problems I've got is rurality of this enormous seat. Bridgewater and West Somerset, of course, is Exmoor, right across the levels, the Quantocks, and the doctors' surgeries are tending to be in the main areas, the conurbations. So if you want a surgery appointment, you've got to go into somewhere, unless you live in Bridgewater or Minehead. And I think the doctors, and what I'm getting is the doctors are just not wanting to do face-to-face consultancy at all. I mean, it's not just one surgery, it's right across the whole patch. I'm also getting cancellations, and that's not just doctors, that's in Musgrove. I'm getting operations changed. I'm getting people who are being told on the day they haven't got the people. Now, okay, COVID does have an effect. I'm getting people who are going in for physiotherapy and many other things that people go in for that are just not getting them. And the worry is this is all backing up. And the more you back it up, the longer the lists become and the more difficult it is. But I think that doctors, I have asked to go around a couple of the surgeries and I mean, they'll say yes, but I haven't got there yet. But I am waiting because I think it's important that MPs do find out what's going on. COVID is hopefully a little bit behind us now, but we still got a huge amount of people who desperately need help from doctors, clinicians, and of course our strategic hospital in Musgrove.
You've had examples. One springs to mind where somebody called up with a broken finger and ended up having to get an ambulance. Can you just share some examples and cases that you've heard, please?
Yes, I think what is important about this is that what's happening is because people can't get doctor surgeries, everything is being put onto the paramedics and the ambulance. And that really is, again, very difficult. Where you've got a vast rural area, it is very much harder for the paramedics and the ambulances to get to some of these places. But also, if you're getting an ambulance from Minehead to Taunton, it's a very long way. Even with a blue light, it's a long way. And therefore, the more people that are being sent by paramedics, where you made the point about the finger, which is just an example, but it doesn't really work. That could have been dealt with in a minor injuries unit. It could have been dealt with by a practice nurse or a doctor, whoever, very, very quickly and dealt with. And unfortunately, the poor person had to then use an ambulance, which they didn't want to, and be taken to the hospital where the problem is fixed. But I do get other cases. Most people are very reluctant to talk about them for obvious reasons, and I certainly would never break the confidence of a constituents. This has always sort of been the case. I mean, this has never completely gone away, where if you have a night call for an elderly person or somebody does something, you tend to go to the ambulance or the paramedic service, and they'll do it. But it's now got a real problem. We only have so many ambulances to go around, and so many paramedics, to be fair, that we need, where there is a minor injury, such as a finger or a toe or whatever it may be, or in the case of an infant, a cold or something where parents are worried, that they're not automatically put into an ambulance, automatically seen by a paramedic, when a doctor could easily suffice. All right, if it's 3 o'clock in the morning, probably not. But through the day, that there should be a mechanism where they can be whipped into a surgery and this can be dealt with before they end up being driven all the way down to Musgrove or to Musgrove from wherever they are, to be looked at by the A&E and the clinical team down there.
What kind of reaction are you expecting from doctors and different staff when you suggest that they should be easing some of the restrictions that they've implemented?
Well, I think there's two parts to this. I will say practice nurses have been working very hard, and they always do. So has the maternity teams, and they always do. What I would like from doctors is to really know what they're doing, how many days a week they're working, how many part-time hours they're doing, and how many doctors there are at each surgery. It's not always easy to know even that, because you get locums coming in. And I think we just need to get a better idea of what's happening in the constituency. When an MP gets a lot of emails, as they are nowadays, not letters, about an issue or telephone calls or whatever, people, it's my job to look into it and see what's the cause is. And I just need to know and understand what is happening across the surgeries, right across the Bridgewater and West Somerset constituency, so that I can not only reassure my constituents, but also pass up to government if we have a problem. And at the moment, I'm waiting, as I said, for those doctors to come back, and I will report back when I hear.